Good afternoon, everyone. My name is Adriana Bolin. I use the pronouns she and her, and I am the Director of Community Impact and Engagement at Fenway Health. On behalf of the Black Boston COVID-19 Coalition and Fenway Health, I would like to welcome you. Welcome. Welcome to our town hall titled, "We Thought You'd Never Ask." Learning from Boston's Black community what supports its health, resilience, and well-being. Today, we will share how we came together as authentic partners, what we did together in the partnership with Boston's Black community, and what we are doing with and about what we've learned in partnership with Boston's Black community. I would like to welcome now Diane Wilkerson, co-founder of the Black Boston COVID-19 Coalition, to share more about the BBCC and why BBCC chose to work with Fenway Health. Diane, you are muted.
All set?
Yes, we can hear you.
Good afternoon, everyone. As Adriana said, Diane Wilkerson, one of the co-founders of the Black Boston COVID-19 Coalition, and just a short history. This thing called coronavirus hit us all in March 2020. We knew two things: that it was going to be bad, and that if it was going to be bad, it was probably going to be worse for Black and Latino people, period. And so with that, we kind of got on the phone and started calling each other and said, we need to get ready. We're not even sure what we're getting ready for, but we need to be ready because we know we're going to have to do some advocacy and some fight. And within a matter of weeks, our 8 turned into 20 and the 20 turned into 40. And I'm happy to say today we have almost 500 members of the Black Boston COVID-19 Coalition, diverse in race, sexual orientation, background, income, from all over greater Boston. And it is because of that motion that we're here today. One of the other things that happened, if you recall, in mid-2020, in April, we started hearing conversations about clinical trials, right? And that the pandemic, this virus, we went from coronavirus, which is what we all knew from the beginning, now to COVID-19. This thing called COVID-19 began right away to ravage our community. And one of the things that we learned in communication and reading is that the various pharmaceutical companies were partnering up with healthcare institutions to develop a vaccine, and that they were going to be looking for people to volunteer in a clinical trial. And so, of course, the Black Boston COVID-19 Coalition began to get invitations and calls. And, you know, we got a call from one major health institution who was partnering with Moderna, asking if we would talk to them about how we could be helpful and help them recruit Black people, because they were having difficulty recruiting Black people. And we said, no, we don't do recruitment, but we're happy to have a conversation with you about how we change this whole narrative. You need to know why Black people don't want to volunteer, why you're having an issue. And so we had that conversation with at least 2 or 3 institutions, and including Fenway Health. And surprise, surprise, 2 of the 3 institutions in various ways, one was very direct and said, no, you guys are too pushy, right? You're too pushy, too demanding. We have some Black people who are not asking as much of us. What we were asking is, you want us to be involved with you? We have to be part of the process. We have to have people in your community space who can relate to you directly: seniors, Black seniors, children, LGBTQ community, the whole gamut of who we are. And so our callback was, no, we talked to some Black people who weren't nearly as demanding, and they just were going to help us. And so, no. So our next conversation was with Fenway Health, and we said, these are the things we have to do. If we're going to be partners, it's got to be real. And they said, we're all in. And that's why we're here today. And we're going to talk over the course of this, of our time, about the impact and detail of what that meant. But it was a significant step forward in the conversations that have to take place, and so that you'll understand what we know now is that it's been very easy. All the conversation about hesitancy, distrust, mistrust, and Tuskegee and forced sterilization. We learned some things about it, and I think more importantly, our partners learned some things about it. And the gist of it is, most of Black people, Latino people, don't know who Tuskegee is, where it is. They didn't know about the 40s and 50s. What they talked about was their experience 2 years ago, their experience a year ago, their experience a month ago with their health institutions. And it was that reality that got us to this partnership with Fenway. Make no mistake, they could have run like everybody else. They didn't. Not only did they say we're all in, but when they said all in, they meant all in. And you're going to learn just about how all in that was, because this wasn't an easy process. This wasn't an easy task. You'll hear from the description. We said, you really want to know why? Why don't we go ask some Black people? I said, what a novel idea, because everybody does reports about us, right? But we did this ourselves, and we went out on the street. We talked, and Jackie Lindsey, who we were blessed to have as a member of BBCC, as was Adriana Bolin from Fenway Health. Jackie took on the charge of managing and delivering this incredible report that we're going to be rolling out today. And so with that, I think I'm wrapping. I did exactly 5 minutes. But thank you. I'm excited. I'm excited about this day.
Thank you so much, Diane. And I too am excited, always excited. And hearing you, Diane, speak of why BBCC chose to work with Fenway Health reminds me of my own why, more specifically, why I started attending the BBCC meetings. And I remember first learning about the BBCC from my colleague, Dr. Bisola Ujikutu, who is like, this is an amazing group of folks who have come together. And I think it would be great for you to be present there. And I loved it. There were a coalition of people representing organizations, institutions, community groups, and stakeholders, all organized around supporting Black people in Boston. To prevent, navigate, overcome, and thrive in COVID. Being present at BBCC meetings taught me a lot and was inspiring. It was important to me personally, for me to be present as a Black person, as a public health practitioner, and most importantly, as a human being wanting good for other human beings. I learned so much from what was being shared about the work being done around the city. And I was also inspired to share the work that was being done at Fenway Health too, that I was involved in, and how it aligned with improving the health and well-being of Black Bostonians. Late 2020, Fenway Health began enrollment for the AstraZeneca COVID-19 vaccine study. We wanted to reach those who were most impacted by COVID-19 and also those who were not as engaged in research, to ensure research data reflected all people. Black people experience some of the highest rates of COVID-19, as I'm sure you know, and for valid reasons have been less engaged in research. When I presented our research study and invited coalition members to share information about the study with their constituents, I was so appreciative and have gratitude for what we were met with. We, as Fenway Health, were called in by the Black Boston COVID-19 Coalition to have a deeper conversation between our leadership to discuss how we were dismantling racism and how we were promoting racial equity, which we agreed were key elements in what we've committed to doing as an organization to improve. I guess my time's up, I'm close though. To improve the health and well-being of our patients, clients, and community. With that, I would like to invite Ellen Lapointe, the CEO of Fenway Health, to share with us why having institutional leadership and support at the table is so important. Welcome, Ellen.
Thank you, Adriana, and hello, all of you. Thank you to all my friends and colleagues here today, and for those of you who've joined to hear us and what we've been doing together. I'll just set the stage a little bit more because I know folks are really eager to get to this report, but it is important, I think, to kind of talk a little bit about kind of why and how we decided that it was essential to show up as we did. So Fenway Health absolutely is on a racial equity journey, and our goal is nothing short of becoming an anti-racist organization. This is a forever journey for us, and it's one that we are fully committed to. I got to Fenway Health in March of 2020, which did in fact coincide almost to the day with the onset of the pandemic kind of public health crisis. But before that, no one knew that was coming when I was interviewing for this job. I was hired by the board in part because of my background and my commitment in leading organizations through change that really does center racial equity. This is something that we had been talking about as essential for the organization to really center in order to remain relevant and to be able to deliver fully on its mission. And that was something that was always in the plan when I got here. And of course, with the onset of COVID-19, which, it doesn't take much for me to just close my eyes and remember just how overwhelming that was for all of us. I mean, it had the potential to derail a lot of things, including this, but it didn't. And I'm really proud of that. In our organization, we did not lose focus. You also, of course, we all remember that the summer of 2020 is when the whole country experienced a very significant new awakening to the horrible effects of racism and white dominant culture when George Floyd was murdered by police officers. That again was I think of it as almost accelerant that allowed us to kind of really move into high gear at a moment when it would have been possible, I think, to go in another direction, but no one wanted to do that. So that was good. So the first thing that we did was to really stop and acknowledge explicitly that while Fenway Health has always aspired truly to be a conduit for marginalized voices in our community, and I think has prided itself as such, the organization drew on existing systems, economic systems, social political systems, and so forth that really do center cisgender white people as the norm and BIPOC people as other. So as the organization grew, that really got baked right into the organization. And this fostered conditions that did feel unwelcoming and still do, can feel unwelcoming to BIPOC individuals and people with intersectional identities. So we really needed to acknowledge that first and foremost, our complicity in perpetuating this and reinforcing racial inequities in our work. And that we were failing to meet our obligations to our community and to deliver on the mission. So the way we started to get into this was we convened a racial equity action team. That's what we called ourselves that fall of 2020. And our goal really was to develop a really comprehensive racial equity action plan, a blueprint, if you will, a roadmap to set forth in detail what our goals would be, what our accountability would be in very specific ways and detailed ways, and what the path we would need to take to transform the organization across a series of dimensions. We comprised that team of people from across the organization. Representationally, it was certainly diverse in every respect, including race, ethnicity, gender, identity, and so forth, but also where people worked in the organization, what level they are at. And we made sure to include people who historically were not usually given a voice when key decisions are being made. And we had 3 board members on this team, which is really important. We engaged Gary Bailey from the Simmons School of Social Work. Some in this audience might know him. He is a longtime community leader and partner in our organization. And we asked him to facilitate our meetings so that I could participate fully, so that I, as the CEO of the organization, could sit at the table alongside everyone else and not run the meeting because of the impacts that can have. And beyond myself, of course, it's much bigger than me. We knew that we needed full board buy-in and engagement, not just approval for our board of directors. And we got that. We needed a senior leadership committee that was really willing and able to create the climate in its own with each of their teams, where change was not just possible, but expected and welcome, and space was made for that. So we have to make space and time for people to do this work and to do the changing that we're expecting. And we needed active participation and leadership of our staff at all levels. And just to be clear, many of our staff for a long time have been making clear what their expectations and demands are of the changes that need to happen in this organization. And those were really centered. The staff was ahead of the organization a lot, as is often the case. We have a BIPOC focused employee resource group called the Racial Justice and Equity Collaborative that for a long time, well before my arrival, had been demanding change and really set the stage and pave the way for a lot of this work. So I want to make sure to say that. So my role really basically was to connect all the dots, basically just keep that energy kind of alive and harnessed, make sure that we didn't lose focus when things got tough and when other very legitimate and big things were coming at us, which they have been and continue to do. So this is our experience, just one organization. It's certainly not the only way to go about things. It is a journey and we'll continue to learn. But what I can say for sure is true is if you really want to transform an organization, you really need leadership and you need to cultivate buy-in and accountability at all levels. And you need to do this work in partnership with community. So that is really one of the biggest take homes of today. Of course, we have benefited immeasurably from our partnership with the Black Boston COVID Coalition. We're going to go through what we've learned and done together, but I just want you to know, all of you, how critically important it has been to have a partner, this partner, an accountability partner, a thought partner, a learning partner to help provide perspective and guidance along the way, help us course correct and help us go deeper and do better. So we are deeply, deeply grateful for that partnership, which has been very successful to date and which we hope and believe will continue into the future. Thank you.
Thank you so much, Ellen. Next, I would like to welcome Jackie Lindsey, member of the BBCC and consultant on this very important project that we did together, to share an overview of our project. Welcome, Jackie.
Thanks, Adriana. And I really want to just welcome everybody who's here. I want to review what the project did and then very briefly some highlights about what we found. I'm not going to go into details. Those are in our report. But before I do that, I want to underscore the little bit that Ellen just shared with you, because a reason that we invited so many leaders of institutions to this town hall today is one of the messages we want to send is leadership really matters, and especially committed leadership. So Ellen was describing a lot of the activities, the steps they took, etc. But what she didn't say, and maybe she couldn't say, is that what really made all of it work inside Fenway with what they did and then with us is that she meant what she said and she stood behind it. And every step of the way, as the project evolved and we needed different things, etc., all barriers were removed for us to move full steam ahead. That needs to be said because she modeled the kind of leadership that we need to see from institutions across this city, which is one of the reasons we did this research and plan to share it widely across the city, including and especially with leadership. This is not work that can just be delegated and left with people at a project level. The institution has to commit to this because, as she said, all institutions are riddled with systemic racism. It's been there for generations. This is a generation and a time when not just in Boston, but around the country, where we're saying, okay, now it's time to do something about it. Okay, so now to what we did. With this commitment, deep commitment coming from Fenway, coming from BBCC, we brought together, I'm going to say something about how we set it up and then what we found. We brought together a steering committee made up of half chosen by BBCC, half chosen by Fenway, and we brought them together to provide guidance to how this partnership should move forward. They were aware of, both institutions were aware of all the data, the challenges the Black community was facing, and the steering committee said, but there's another story that's not being told, and we want to find that out And we want to go to the Black community to find it out. And that is, with all these challenges the Black community is facing, what is supporting their health, their well-being, their resilience, and their hope? So that's what we sought to find out. And before we did that, we wanted to make sure what the goals of this partnership are, and they still guide this partnership. I want to share with you those first before I then move to share with you what we found. These were the goals that BBCC and Fenway Health set. Understand and improve the health and well-being of Boston's Black community during the current and evolving pandemic and its impacts, as well as longer term. Understand how systemic racism has undermined these outcomes. Develop a plan to address the systemic racism we find, and then take action to address it. Help Fenway Health become an anti-racist organization and build a race equity culture in order to effectively serve the Black community. Collect, share widely, and continuously improve data and metrics that tell the truth about the health and well-being of Boston's Black community. And then develop a case study of what we learned through our partnership and share it with others widely so it can help inspire and equip them to improve the health and well-being of and partnership with Black communities in Boston and everywhere. So we brought the steering committee together. They decided that we really wanted to learn about what supports the Black community's health, resilience, well-being, and hope. And what we decided, the steering committee said what they most wanted to learn is, what is it that the Black community values and trusts in the healthcare system and beyond? What works to support the Black community's health and well-being? What doesn't work? What priorities need to be addressed to overcome these gaps and barriers? And which organizations should BBCC and Fenway Health work with to address priorities important to the Black community for addressing its health and well-being? We conducted this research in August of 2021 with different parts of the Black community: elders, women, men, young adults, African community leaders, because we have a diaspora living in Boston, and members of the Black LGBTQIA community. These groups also included people from the healthcare system, the education system, the social services system, the faith community, and running groups, because we wanted as diverse a perspective as possible. And now I'd like to share with you key themes that emerge from listening to the Black community. First is what Black people say health and well-being look like and mean to them. Valuing each person's humanity, each other's humanity, supporting each other when we're in need, preventing further suffering, and supporting individuals and communities to become whole. It means comprehensive healthcare, equitable healthcare, and equitable access to healthcare. It means cultural humility and respect for Black people within healthcare and other systems that impact their health and well-being. It means safety. It means self-determination and independence. What Black people trust in the healthcare system: walking in a space of shared humanity with their doctors, having the option to choose their primary doctor, the opportunity to connect with and be cared for by Black healthcare professionals, being able to have people they trust accompany them on visits to the doctor as advocates. What Black people don't trust in the healthcare system: healthcare providers who don't recognize the humanity of Black patients or their family members or community and don't treat them with respect. Health providers who are not culturally sensitive to Black people, whether born here or immigrants, or to people from the LGBTQIA community. Doctors who don't trust that their patients know something about their own bodies. a physician who doesn't listen to or follow through on their patients' questions and concerns, doctors who don't inform their patients up front about what costs the patient is responsible for regarding any procedure the doctor recommends, and having to wait forever to get an appointment. Who gets health care? In our study, the overwhelming majority of people who participated in our focus groups reported they get health care and use it. And our survey participants, 97% of them said they get health care. Besides health care, what else Black people do to support their health and well-being? They stay up to date regarding what's important regarding their health, and they learn to advocate for themselves within healthcare and other systems. They get mental health support. They prioritize self-care and try to keep their homes as peaceful places to unwind. They engage in physical activities, sports, spiritual practices, meditation, and yoga to support their physical and their mental health. Many experience running as an activity that brings both physical and spiritual benefits. They try to surround themselves with positive energy and relationships, people who love and trust each other and support each other's healthy lifestyle, development, growth, and agency. They maintain their social life and community connectedness. Key barriers to the health and well-being of the Black community and what's needed to overcome them. The greatest barrier of all is systemic racism in healthcare and other systems that impact the health of the Black community. As one person put it, we lack access to employment to support and sustain our families, to healthy food and food security, to quality and affordable healthcare, housing, and education, and to the tables that make decisions for all these systems. In short, we lack access to the social, economic, and political resources we need to support and sustain the health and well-being of our families and the Black community. Black people need personal, social, and spiritual safe spaces as individuals and as a community to unwind from racism's impact and to communicate, connect with, and support each other. And very quickly, what could bring increased wellness to the Black community? Counteracting stigma and stereotypes around race, culture, gender, and HIV. Understanding that the Black community has assets that can be built on to strengthen its health and well-being. Developing a more human-centered approach to healthcare. Adding more healthcare professionals who are Black and people of color. Understanding within the healthcare system that wellness is not just about healthcare. It's about addressing a person's basic needs. Reaching and empowering people not currently served by our healthcare system to gain access to key resources they need to protect their health. If health and well-being were fully present in the Black community, you'd see increased mental health, support for it, and overcoming the stigma of it. Black people participating in a healthy economy inside their community as well as in the wider world. As a result, you'd see parents able to support their families at a threshold level of well-being because they receive a life-supporting wage. Black people would have access to high-quality healthcare in their neighborhoods, and cultural competence and cultural humility would be widely practiced in healthcare institutions in our neighborhoods and across the city. And finally, we wanted you to know that in this report, after sharing these key themes, the report presents detailed key findings regarding the central questions we pose to the Black community. It concludes with an appendix that shares powerful stories that bring vividly to life the actual experiences of Black people in Boston. These stories are included to help healthcare institutions and all of us learn from Black people, connect with their humanity, and be inspired to do something about the issues and priorities they urge this city to address to improve their healthcare and health outcomes. We invite you and your institution to join us in using this research to inform institutional and collective action that makes a difference in Black people's lives and can support them to thrive.
Thank you so much, Jackie. Thank you so much. And next up, I would like to invite Carl Schwartino, our Executive Vice President of External Relations at Fenway Health, to share more about what we've learned from this project and how we're using what we've learned. Welcome, Carl.
Thank you, Adriana. Nice to see all of my colleagues here on the screen, and just glad to see so many folks in the audience listening and learning, and appreciate the attention and focus on this issue today. And for those of you watching, I just want to say the folks around this screen, it's been a true pleasure and learning experience and delight to get to work with each of them in this journey over the last couple of years. So just nice to see all of your faces. As Ellen shared, Fenway Health is on a journey, and I thought a lot about how to share what we've learned so that might be useful to others. And I would sort of tongue-in-cheek call this a tale of two stories, if you'll indulge me. The first story is really about what you just heard from Jackie, which is what we learned and captured in our report about how to support the health and well-being of Black Bostonians. We learned about the barriers that exist in our city, what gives people hope, and how important trust building is. This really is a story about systemic change and addressing how racism is affecting a whole community. And it's about how institutions such as ours can be a part of the problem or can begin to understand their role and make transformational changes in how we do business. For Fenway Health, as we began to learn through this project more about what Black residents of Boston, in Boston, are experiencing with access to care and services broadly defined, we began putting that knowledge to work even before we finished this project. The learnings that we were hearing from the focus groups and surveys, we were able to incorporate into our own ongoing effort around racial equity in the racial equity action team that Ellen referenced. If you look at our racial equity action plan, even in the language that we were choosing to use in our racial equity action plan, was it refined and adjusted based on what we were learning and hearing through the BBCC and our focus groups. And we added some more specific measures of accountability, specific progress measures to our report, realizing there are things that we wanted to make sure that we really got right and were really specific to what we were hearing in the community conversations we were having. I want to invite you, if you're interested, you can check out our racial equity action plan that we're referencing on Fenway's website if you're curious to see that in more detail. But that brings me to the second story of my tale. And that's the story of the journey of Fenway Health and BBCC that we're alluding to as partners in this work. And it's really a story about the process that we went through as partners, as much, if not more than, the final report product itself that was the learning for me that was the most incredibly valuable part of this experience. You'll see in Fenway Health's Racial Equity Action Plan that we have a whole section on community engagement, on how we show up in the world. And rather than just naming the importance of community engagement or getting feedback from stakeholders as so-called advisors, we began to embrace the concept of authentic engagement with the communities we serve, as well as the communities we would hope to better serve, not as advisors, but as partners and leaders in this work. We know this from the HIV movement, which Fenway Health has been a part of since the very first days of the HIV epidemic. The HIV movement adopted a phrase, "nothing about us without us," centering people impacted. Our job here in this process at Fenway was to translate that principle, which was already in the DNA of our organization because of our history with HIV and serving LGBTQ people, and make sure we were applying that same principle and practice into and around our anti-racist initiatives. Authentic engagement with those affected by the policies we make and the practices we adopt is a core principle we heard over and over and over again as being key to trust building from the Black residents we learned from in this process. We're examining as we speak at Fenway what it means to authentically engage, to strive not just for communication, but partnership, to ensure the dialogue we have with community is having an impact, is bidirectional, and is not just checking a box to say we asked someone and they gave us their opinion. That work is in progress, and we're continuing to learn what that even means for us as an institution. As you heard from Diane, Fenway and BBCC had to have what I would describe as some difficult conversations. They were difficult at times because they were honest. We were at the start of a relationship. I use that word intentionally. This was a relationship we were trying to build and establish. And we had to take the time to understand where we had common ground and shared priorities. And at times we were missing the mark or misunderstanding each other. And for Fenway, it also meant being open to inviting others from the outside to look under the hood with us, unfiltered, and acknowledge as an institution where we were falling short with humility and openness to learning. And BBCC, as you can tell, for me personally and for us as an institution, became a true accountability and thought partner, as Ellen mentioned, for us as a place where we could be held to account in the most positive of ways to make sure that our aspirations and stated goals were actually being carried through. And I can't thank the BBCC enough for being that partner with us. I share this second tale both as a cautionary tale and as an invitation. It's a cautionary tale because I want to be explicit that no institution can just pick up our report or pick up Fenway's Racial Equity Action Plan and try to, with a little bit of editing, make it their own. That's not the point of even sharing this journey with you. It takes an investment of time and energy, and it requires a dialogue that is grounded in honesty and openness, true dialogue. But it's also an invitation to share the story with you because there, from my experience, is so much joy in what can be found in doing this work to transform an organization or institution from one that is shaped by white dominant culture towards becoming an anti-racist organization. Yes, joy in doing this work. There's so much joy in seeing BIPOC staff and community members and patients not just see the start of long overdue changes, but be a part of shaping and driving the change, centered in the work, but not having to bear the burden of doing all of the work without buy-in, support, or resources. There's so much joy in seeing the promise of an organization like ours, not just accept, but embrace the responsibility that we have to do things differently. It's not easy work. It can't happen overnight. And we're certainly nowhere near done. But if it was easy, it would have been done already. So we have to start somewhere and not give up, keep moving forward. Our organization happens to be founded on serving underserved and stigmatized communities, the LGBTQIA+ community and those living with HIV. But I would say that every mission-based institution needs to be asking whether their mission is truly being accomplished if Black, Indigenous, and other people of color are not seeing, feeling, experiencing, benefiting, or fully and wholly a part of all that we do. So I hope that our tale is helpful to you in some small way. I hope it inspires you to want to do more, to take those next steps in whatever part you are in your own journey. And please do consider Fenway Health a very willing ally and thought partner in the work that you may be doing at your own institutions. And reciprocally, we'd love to learn from you and your experiences as well. So thank you.
You could just skip it and I just will introduce, I'm back. And I'm really wrapping up because I'm more excited about what's next, the time that we're going to spend hearing from you, answering questions, just to do what we call the call to action. And so here it is. Starting today, the report in all of its wonder, and I think it's almost 70, 80 pages. So it's not a quick read. And it's probably not the kind of thing you pick up and just start reading. You'll go to sections and you'll read and really reflect on it. Carl said it best. We don't expect that people are just going to take the report and look at the racial equity plan for Fenway and what they use and say, here, we can be a racial and social justice equity institution now. It doesn't work that way. It really does take work and it has to be committed to work. Anything that takes the kind of time and energy to create, which is what we have been living in, is going to take a little more than a read to undo. But what happened is that they committed to undo it. You know, much has happened. We talked initially about how we got started, and I really want to get us to today. This report is going to be available on Fenway Health Center's website, And also Black Boston COVID-19 Coalition's website. By the end of today, you'll be able to read it. We want you to read it. We want you to share it. We want you to think about ways in which it might be helpful in your work. Why is this important? Because we are hearing from healthcare institutions right now the same issues and concern about their inability to get and secure sufficient numbers of Black and Latino people to participate in the long COVID study, which is important to us because it's the study of, well, what do we do next? If it's true, and there's no reason to think that it is not, what the healthcare officials are saying is that we're going to see this a few more times. It's not going to be over. It'll be a new name, maybe a new variant even of COVID-19. But the reality is that you can't study impact without having a proportionate representation of the people who were most deadly and harmed and affected and impacted by this. That would be us. No discussion, no dispute. So we want to see our folks participating in the study of what long-term COVID means and the lingering impact. And so that's why we think this is timely. As I said, we were already hearing it. The other thing is that I mentioned at the outset that there were 3 institutions we approached, and 2 of them pretty much said, go kick rocks. That is even changed. After some 2 years in a process, I am so excited about what's happening, and the questions that we're being asked, that we're talking, we're meeting and working and talking with BMC. We have an incredible relationship that's been fostered by the board of directors and the staff at Brigham and Women's Hospital, who has been through their own kind of transition and called us and said, we want to talk, we want to meet. And we're meeting at the highest level. Why? Because the last thing that was said is so important. Ellen said, only 2 things that will make this work. There are other things you can do, but there are only 2 things that will guarantee you some success. Leadership from the top, right? And buy-in from the community. And often those things you get one and not the other. Here we had the perfect combination. So we want to hear from you. We want to say thank you. I want to say thank you to all the attendees. I see so many of the BBCC members. I see so many members representative of healthcare institutions, and even hospital boards. We don't take this lightly. It's Friday afternoon. You could be doing many different things, and you chose to be here, and we are appreciative of it. This work is authentic. This work is intentional, and we want to continue this with you because the health of all, our collective health, is in our collective interest. And I think that is really the thinking that has been pressing and pushing us forward, and look forward to continuing to doing that work with all of you.
Thank you so much, Diane. And with that, we are going to dive into some questions. And the first one being, and I will send it out for all of us, and whoever would like to speak on behalf of it, feel free to. The first one is, what do you think are the building blocks of authentic partnership?
I can start with one that I think about. I think about the words partnership and relationship as being synonymous a lot. Like in any relationship in my life, I try to be in relationship for its own sake, not because I want something. And I try to build a real connection to someone that's authentic. And over time, I will call on them for something and they'll call on me for something, and we'll help each other out. But really, we're in it because we really are just appreciating one another. And I don't think it's any different in this context. So that's one.
Yep. I think the second one for me, patience. Shortly after we all watched this execution of George Floyd, I posted something that is true today. We have to give each other space to figure out how to move to the next step. We're going to, even when you're dealing with people who come committed to doing right, they may say some things with the best intentions that really hit you wrong, right? Your response may be something that sounds a whole lot harsher than it needs to be. So I'm serious when I tell you that patience is absolutely critical. You've got to give people some space to not necessarily say it right when they mean right, right? And because if you shut them down, they're not going to be willing to be open as they need to be for us to get to the next step. And I think that's really been the heart of what Carl even said when he talked about the intense and tough conversations. You could slam the door and check off and go away. Nobody did that. We're staying here, hear me, and I want to hear you. So that patience is absolutely critical.
I think a shared sense of purpose, and I mean really authentic commitment, and trust is something about it in the early stages, because trust gets earned and built, but there's something, even a willingness to trust, as well as grace, because that taps into what Diane was talking about. So if you have this shared sense of purpose, you have a willingness to trust. You haven't gotten there yet, but a willingness to, and you extend each other grace as you inevitably make mistakes, misunderstand, or whatever. But I have to say for myself, I never found our conversations difficult. We really took a deep dive from the beginning. And I mean, we were all in. There was no hesitation about it. In fact, there were times after our meetings when Carl and I would stay on the Zoom and we'd go for another hour because we were diving even more deeply into it. And those things, we only went there because we were trusting each other. And we were anticipating what might happen. And we were trying to do what we could collaboratively to make sure that we were supporting the project to succeed. So there's some kind of, assuming positive intent, a willingness to begin the trust in the journey and extending grace, and then diving in. Yeah, those are the building blocks for me.
Thank you.
One thing to add briefly, I'll just add the word curiosity. I mean, Jackie, when you just mentioned it, I have this very, like when I said the word joy earlier, it's our little add-on conversations brought joy to me because I was trying to approach it with curiosity. You were curious about us. It was a learning journey together. So I just want to offer the importance of going into conversation without self-determined opinions about what needs to happen, but with curiosity about what could happen. And that's why I really enjoyed this process, actually.
Yeah.
What I'll share too is similar to what Jackie mentioned about purpose. For me, it's really important to know my mission and to make space to understand others' mission and to see how they align. That really helps with authentic partnership for me. Any other contributions before we move on to our other great questions? Thank you all. The next one says, thank you so much for hosting. It's such a gift to see so many in Boston share your process and learnings. Sorry.
I'll read.
April was having a fire alarm test done at her home and was about to close it out, or you?
Well, let me read the rest of it then.
Thank you.
I'm wondering if you have any advice on or could share any recommendations for researchers working at institutions here in Boston who want to create much needed change, but perhaps don't hold leadership positions. Great question. And my first suggestion would be that we don't always play the inside outside game very well. Here's what I mean by that is I was intentional when I commented that I see so many people on this list who are working and involved in healthcare institutions. Our task, and I see that as BVCC's task in particular, is to target your leadership to make sure that the space is created, that will is there, because we could be talking to you and we can work, we do this in Boston a lot where staffs get together and find out, well, guess what? Like the leadership didn't buy in. So when we started listening and hearing about the NIH study, Jackie will tell you the first thing I said is we have to go talk to the presidents, because I know, the principal investigators, they'll do a good job. I want to know what the hospital president has to say about this. Is this just another project, or is the institution committed to it? And I think it's one of the things that we don't spend enough time and strategy on. So Ms. McCallum, to that question, I think the most important thing we can do is to be that outside press and agitator and communicator. And we're going to be pushing this report. And even for our next step, we're doing surveys right now, Black Boston COVID-19 Coalition, on the impact of COVID-19 on your family's health and your family's financial status. Why? Because we need to know that. And I think the answer to that answers the next question that I saw about what do you do with policymakers? The whole purpose of this process for us is to be presenting this to policymakers. This is budget time. You read the Globe, right? 3 weeks ago, there was an article in the Globe, of course, catches my eye because I'm a policy person, likes to connect policy with resources. The article caption was, Massachusetts is flush with cash and doesn't know how to spend it. I can imagine in your silence, many of you were like, I got an idea, because we do. The whole point of this process is to be able to present it to people on the policy side who are going to be deciding how to spend the city's resources, and recovery in particular, the state's resources, because there has to be a connection.
Diane, there's something about what you're saying that makes me want to share this with everybody, which is this. One of the reasons it's important for somebody to be engaging leadership of institutions, all of them across sectors. The reason that's so important is actually there are a lot of people within institutions who want to see those institutions do the right thing, but they aren't necessarily in positions of influence to set that as a priority.
That's right.
And I want to say, we are in an era, something we've never been in before, and this is a real opportunity. We are in an era where we have an opportunity to break through, truly break through around the systemic racism that's everywhere. Like, we don't even have to debate that or argue it. It's everywhere. So if that can be a starting point, like as a fact, and then the conversation can shift to how do we do it? We do know that leadership plays an important role, and their commitment really matters, because once it's there, the people in the institution who want to do the right thing feel like the leadership has their back. And so I want to say I know that BBCC is committed to improving the healthcare and health of our communities, and we will work with leadership inside, but we will also, as Diane said, work from the outside, because we're really committed to saving the lives in our community and also to supporting our community to thrive. That's what it means to really break through the systemic racism, so that we're not always trying to close these gaps, but we're really trying to create opportunities for people to thrive.
Thank you all. Thank you. And another question that we have is, what do you think gets in the way of authentic partnership?
In Boston, I would respond in the context of authentic partnerships around issues of race, because that's the answer. What gets in the way? It's the most difficult conversation. It's a difficult topic. It's emotional. It's political. It's social, right? And all of those things. And so you really can't separate those things out. If we're going to have an honest conversation, it's going to be intense, emotional. We have to talk about how we have it. And I think that has been the challenge for Boston is, and I'd say across the country, is how to have it, and not being in a position where, as I say this too, if you really want to have one, you can't set parameters and restrictions about how to have it. And so, for example, I don't want to have that conversation because it's going to make me upset. Well, or you can't talk about it in a way that is emotionally charged. It's my being. It's going to be emotionally charged because it's about the fact that every single week for 112 weeks since we started counting in April of 2020 in Boston, every single week, and not a week when Black people did not top the ticket for the number of deaths for COVID. So it's going to be emotional for me because when people don't do right and we're not focused, Black people die, Latinos die, and we are dying. We are the only sector of people in the city of Boston who have been dying from COVID at a rate higher than our very presence in this population. And I have to school people when I say that. Asians, 12% of the population, around 6% of the deaths. Latino, 19% of the population, 12% of the deaths. White Bostonians, 44% of the population, 44 and less percent of the deaths. Black population, 24% of the population. We have never been less than 32%. Not one single week have we fallen off the top. Not 1 week since April of 2020. So it has to be emotional for me. And I think people need to understand that. This is like, I can't be calm about that kind of carnage when there's things that I know we can do to change it. That's why this process has been so welcoming to me, because we've been talking about how we really impact that. It's not just that we want to whine, it's that our grandmothers, our fathers, our sisters, our cousins, our children are dying because of our inability to get a handle on how racism impacts the delivery and the reception and the ability to receive healthcare in a city with the best healthcare on every front. Literally, you could walk out your door and see one of the hospitals. But somehow we have the worst health indicators. We have to fix it. And I'm optimistic that there's a way to fix it. And I think that this report is really the start. It's not the fix all. It's the start of the conversation that kind of opens up the floodgates, I hope, right?
I think one of the things that gets in the way of authentic partnership reminds me of something Ellen said when she said, for her, relationship and partnership are almost the same thing. The thing that gets in the way of it is fear, the fear of telling the truth. Like what Diane is describing. If you're a Black person and you're experiencing all of these things, and by the way, you've been experiencing them for generations, including what you're experiencing now. But when you're experiencing that, that is the truth of your experience. And when you put it on the table, and you're putting it on the table to share it because something needs to be done about it, what I often find is that white people or any other people who are not having that experience are often afraid to talk about it. And I think what we need to do, because lives are at stake, we have to talk about it. And one of the things that I know, and I'm not afraid about, is that I know that if we lean in and actually tell the truth about it, it's what Diane said, there's something we can do about it. And that's the thing that excites me, drives me, inspires me. These deaths are preventable. There are things we can do about it. There are things each one of us can do about it. There are things leadership can do about it. But to move that needle, we have to do it together. If we're going to do it together, we have to talk to each other. If it's going to be effective, we have to tell each other the truth. So it begins with that truth telling, moving through our fears to just put it on the table and know that when you do that, you're not going to get erased. You're not going to get cut off at your knees because you're telling the truth. What you're going to do is tell the truth and then figure out together what you're going to do about it. And that's the thing we heard again and again from people that we engaged in this research. They said, we're telling you our truth so that you can put that out there so that it will be put in the hands of people who can make a difference and do something about it.
So we told you all 12 to 1,
Yeah.
and I think we're doing pretty darn good because we're wrapping
Yes,
up
we
now.
are.
I'm
Yeah.
going to ask Ellen if you could do a 60-second kind of your final thoughts, and then I'll
Sure.
reiterate again how people can access the report, and we'll be done for today.
I won't even do 60 seconds. I'm just gonna really express gratitude. If you haven't, if you've been listening in, what you can, I hope, feel is just the genuine pride we have in the work that we have begun together that is just at the beginning, in the regard that we have for one another, and the shared commitment and passion we have for this essential work that we're doing. And you know, the report is a starting place for conversation. It might be a way to start it, just get the conversation going. But I guess our shared advice or counsel to you is get the conversation started. Why, if not today, then when?
And our niece don't want to ignore, her question is, there's been so much trainings on racial equity, diversity, and all the various titles, but once folks go home, are they really practicing what they learned? I think my response to that would be, I don't know. I'm more concerned about what they do in their workplace, what they do in the space where they're impacting other people. And so that's really our challenge, right? And we'll know whether things are changing when we see things change. Like, I can tell you that the staff, the look, the vision of Fenway Health right now looks totally different than it did 2 years ago, because of the work that they did. Those are so the proof is in the pudding, or in the pictures, or in the actions, and not so much even the words or even what people are thinking, it's what they're doing. We can't police what they think, but we can comment and act on what we do. And that's really what this is all about. Again, you can, thank you, Adriana, she put the link in the chat or the report. But just know you can go right to Fenway Health's website. It will be on BVCC's website. By the end of this day, you'll be able to go on the BVCC website as well. www.blackbostoncoalition.org, one of the two, but you can find it on our website. And we're serious about it. We're going to be transitioning for all the reasons that we've talked about. Boston Black COVID-19 Coalition over the next few months will become Boston's Black Health Coalition, because we are now in the point where we clearly are going to have to address more than COVID, and based on what we learned on just how we live. And so stay tuned for that. We're not gone. We're just packaging to meet the reality of the times. This report is going to be delivered to our policymakers on the city level, on the state level, to our institutional hospital leaders. And Jeanette Callahan, thank you so much. We look forward to working with all of you to impact the reality of healthcare, in Boston. We think we can do something that becomes reciprocated or replicated in other spaces, because it's not much different. But thank you so much for giving up your day. Adriana, you've been the incredible, gracious host, right? Banner White's got nothing on you. Right. And Bryn, thank you too, our technician who's kept this going so smoothly. We'll be back. Thanks, everybody, and happy Friday. Stay safe.
Thank you all. Good to see you.
Thank you.
Thank you.